seems to be the problem today, Mr. Smith?
Well, sometimes I just forget what I'm doing. I guess that's kind of a problem. Just been really depressed and really anxious about everything lately. My vision's been blurry, just having trouble remembering things that I used to not have to worry about remembering. It was just stuff I just knew, and now I just don't know it anymore. That's about it.
And how long has this been going on?
Started noticing it a couple months ago, I would say.
Okay. Alright, I would like to run a few tests, if that's okay with you. I'd like to rule out a couple of the common diseases such as encephalitis and chronic meningitis.
Okay.
And to do this, I'm going to go ahead and do an EEG to detect any abnormal brain activity. And I would also like to do a spinal tap. And after that, I am going to recommend an MRI so we can see if you have any degeneration in your brain, unfortunately. This could be a cause of your symptoms.
Alright, doctor. I'll see you in a week.
Okay. Unfortunately, Mr. Smith, after running all these tests and careful consideration of myself and my colleagues, we believe you have a rare degenerative disorder called Creutzfeldt-Jakob disease.
How do we know that it's not something like Alzheimer's? How do you know it's this?
Well, Alzheimer's is much more slowly progressing than Creutzfeldt-Jacob's. And since you have only been experiencing these symptoms and they've gotten so much worse so fast, we believe that Alzheimer's isn't an option.
So what's gonna happen to me?
It's a rare disease that affects only 1 person out of 1 million per year worldwide. And at early stages, people have failing memory, behavioral changes, and a lack of coordination. As you can tell, you're still in the early stages. As time goes on, you will, however, have increased mental deterioration, increased involuntary movements, blindness, weakness, and finally you will fall into a coma.
So, how did this happen to me?
Because you have no family history of CJD, I believe that you have the sporadic category of the disease.
And what are the other kinds?
There is hereditary and acquired. Hereditary is ruled out because you have no family history, and acquired is not an option because you have never been around spinal fluid of someone infected.
Right. Okay. So, once I'm in a coma, does that mean it's over? Am I gonna die?
Unfortunately, there is no cure or control for CJD. All we can do is make you comfortable and alleviate symptoms. I will prescribe opiate drugs to relieve any pain you may experience, and also I may prescribe clozapam and sodium valproate to relieve myoculus, which is your muscle spasms.
What just happened? Yeah.
Yeah.
Okay. So, how long do I have for all this to take place? Well, what's the timeline?
90% of individuals die within a year.
You're kidding me. Oh no.
I'm very sorry.
It's alright, doctor. There's nothing you can do about it.
Would you like us to contact your family for you?
I have no family.
Creutzfeldt-Jakob disease is a very rare disease that affects 1 in every 1 million people per year worldwide. It is a rapidly progressing, degenerative, and fatal brain disorder. 90% of patients diagnosed with the disease die within 1 year of their diagnosis. Typically, symptoms begin after age 60. As of right now, there is no cure or controlling of this disease. There are three types of Creutzfeldt-Jakob disease. Sporadic is the most common, which accounts for 85% of cases. With sporadic CJD, the disease appears in someone with no known risk factors. Hereditary Creutzfeldt-Jakob disease accounts for 5 to 10% of cases. This type of the disease appears in someone who is tested positive for a gene mutation correlated with CJD. The acquired CJD accounts for less than 1% of cases, and this is when the disease is transmitted by exposure to infected brain or nervous system tissue. Symptoms of the disease include but are not limited to memory loss, depression, anxiety, blurred or loss of vision, loss of coordination, muscle spasms, and trouble eating and speaking. Here you can see that the physical size of the brain actually decreases as the rapid deterioration occurs. Also, if you look at the microscope image, you can see the spongiform pathology characteristic of Creutzfeldt-Jakob disease. The white spaces are the areas that are affected by the disease. Here we have a comparison between a brain infected by Creutzfeldt-Jakob disease and a normal healthy control brain. As you can see, the CJD brain has much larger ventricles and a decreased size overall. The control brain looks much healthier and seems to have more white matter as well. Currently, there is no scientifically proven cause for the disease. The leading theory for sporadic CDJ is prions. There are two types of prions: normal, which are harmless and natural in the body, and infectious. The normal prions spontaneously mutate and fold into the infectious form when a person develops CDJ. Infectious forms clump up and lead to neuron death. It is also proposed that hereditary CDJ is caused by the mutation of the gene that controls prion folding. As of right now, there is no cure for Creutzfeldt-Jakob disease. Once the infectious prions are introduced to the body, they cause other proteins to malfunction, which result in strands of bad proteins. This is simply too quick to combat. Steroids, antibiotics, and antiviral medicines have been experimented with and tried, but with no success. Well, it's been a couple of months since the last appointment I had with the doctor, and she wanted me to make a video. I guess she just wanted me to be able to watch myself at a later point in this disease. So here's the video. I've gone completely blind now. It's just part of the progressions. I was aware. Sometimes I forget my own name. In fact, well, I guess any time now it'll get to the point where I won't be able to talk anymore. And eventually I'll have to stop moving around too. So I don't really know what I'm going to do with my life. It's just really not a cool thing, not a cool disease, I'm just going to die. And there's nothing they can do about it. And I'm just slowly drifting away now. I have moments of clarity, like this one, I suppose. But it's not always like this. 5 minutes from now, I probably won't even remember making this video. So that's just the way it is. That's how it goes, I guess.